In this video, I want to discuss some of the structures of the eyeball. I'm not going to talk about the muscles that move the eyeball, the extrinsic muscles of the eye. We've done a separate video on the muscles of the eyeball already. So on this view, I just want to take care of some of the layers of the eyeball. The eyeball is actually divided into 3 layers, also known as tunics. And from this view, we can see the outer white portion of the eye. This is called the fibrous tunic. And the fibrous tunic is actually divided into 2 different regions. The clear part of the eye, known as the cornea, and then the white part of the eye, known as the sclera. So the cornea and the sclera, both part of the fibrous tunic. Now here we've cut away a portion of the fibrous tunic so we can look deep to that. The next layer in is called the vascular tunic. And you can see here on this model depicted are blood vessels spread out on the vascular tunic. So its name is very appropriate. From this view of the model, we can't see more of this vascular tunic, but when we look inside the model, we will see more of that layer. The last thing I want to point out on this lateral view of this eyeball is the optic nerve. The optic nerve, cranial nerve number 2, is sensory for vision from the eyeball. It is slightly to the medial and inferior aspect of the eyeball. I have removed half of this eyeball so that we can see the other structures. Again, the 3 tunics of the eye. Here we can see the white is the fibrous tunic. Then we see a brown layer, which is our vascular tunic. And then we see a pinkish layer. That is the nervous tunic. Some books call it the retinal tunic, and it makes up the retina. If we come toward the front of the eyeball, again we see the sclera and the cornea, both part of the fibrous tunic. The vascular tunic posteriorly is known as the choroid, and then as we come forward, it widens out into an area known as the ciliary body, and the ciliary body will have ciliary muscles which will control the shape of the eyelids. We'll talk about that briefly. And then it also extends forward so that the vascular tunic makes up the colored part of our eye known as the iris. So the iris is part of the vascular tunic of the eye. And then in the middle we have the structure known as the pupil. The pupil is actually the anatomical lack of a structure. It is an opening in the middle of the iris. Directly posterior to the pupil we see the lens of the eye. From this angle that actually defines some different chambers of the eye. We have the anterior chamber of the eye, which is located between the cornea and the iris. That is known as the anterior chamber of the eye. It is filled with a fluid known as aqueous humor. Between the pupil and the lens, or between the iris and the lens, very hard to see on this model, is a much smaller chamber known as the posterior chamber. That chamber is also filled with the aqueous humor. It is in continuity with the anterior chamber through the opening of the pupil. Behind the lens of the eye, we have what is known as the vitreous chamber. The vitreous chamber is not filled with aqueous humor. It is not filled with vitreous humor. It is filled with a jelly-like substance known as the vitreous body. Vitreous body. Now notice on the posterior portion of this eyeball, right here we have a white spot. That corresponds to where the optic nerve entered the eye. There are no photoreceptors of the retina at that spot right there, so it is often referred to as the blind spot. Its anatomical name is the optic disc, also known as the blind spot, because any light focused on that portion of the retina will not stimulate any sense of vision. Now if I rotate this model just slightly, we can see as the retina comes forward and meets the portion of the vascular tunic coming back from the ciliary body, we have a serrated edge. That serrated edge is known as the ora serrata. The ora serrata. Now I want to take just a little bit of time to focus in right here on the ciliary body. In that ciliary body, I said there were ciliary muscles. And those ciliary muscles attach to small ligaments known as the suspensory ligaments of the lens. Those fibers will attach into the lens so that by putting tension or releasing tension in those ciliary muscles, we can control the shape of the eye lens. I will leave it to your individual lecture professors as to what they want you to know about that particular structure. From this angle of the eyeball, we can see some other things that weren't shown on the other side of the model. A quick recap though, the white is our fibrous tunic, the brown, our vascular tunic, here as the choroid, and then here as the ciliary body, and here as the iris. We can see the anterior chamber. The posterior chamber we have to imagine because we do not have the lens, and then the vitreous chamber. But I want to focus on the back of this vitreous chamber. Here we see somewhat of a brownish spot, more of a peach color. That is called the Macula Lutea. The Macula Lutea. And in the very middle of that Macula Lutea, we see a yellow spot known as the Fovea centralis. The Macula Lutea is very good color vision. There are more cones in that area than there are rods. And in the very middle of that Macula Lutea, when we get to the Fovea centralis, we have our very best focused vision, and it is mostly color vision. That area, that yellow spot, known as the Fovea centralis.